What medications induce ovulation for PCOS conception? If you are trying to conceive and have polycystic ovary syndrome, understanding your options for ovulation medications is important. PCOS often causes irregular or no ovulation, making pregnancy more difficult. Luckily, there are medications designed to help your ovaries release an egg each month. Let's look at the main options, how they work, and what you can expect. First, the most common first choice for women with PCOS is a drug called letrozole. It belongs to a group of medicines called aromatase inhibitors. Letrozole works by lowering estrogen levels temporarily. When estrogen drops, your brain signals your body to produce more follicle-stimulating hormone. This hormone stimulates your ovaries to grow follicles and eventually releases an egg. Usually, you take letrozole as a pill once a day for 5 days, starting early in your menstrual cycle. Studies show it often results in higher ovulation and pregnancy rates compared to older drugs. It also tends to have fewer side effects on the lining of your uterus and cervical mucus, which can help with conception. Since letrozole was originally used for breast cancer treatment, doctors prescribe it off-label for fertility, so it's important to have your doctor monitor your response. Another oral medication used is clomiphene citrate, commonly called Clomid. Clomiphene works by blocking estrogen receptors in your brain. This trick makes your body think estrogen levels are low, prompting it to produce more follicle-stimulating hormone. You take clomiphene 4-5 days early in your cycle. It has been used for many years, but recent research suggests letrozole might be more effective for women with PCOS, especially if clomiphene doesn't work. Clomiphene can sometimes thin your uterine lining or affect cervical mucus, which might make it harder to conceive. If oral medications don't work, your doctor might suggest injectable hormones called gonadotropins. These are hormones like follicle-stimulating hormone and luteinizing hormone, given as shots under your skin. Gonadotropins directly stimulate your ovaries to produce multiple follicles, increasing the chance of ovulation. However, women with PCOS are sensitive to these drugs, so there's a higher risk of producing too many follicles, which can lead to multiple pregnancies or ovarian hyperstimulation syndrome. Because of these risks, gonadotropins are usually used after oral medications have failed and requiring close monitoring with ultrasounds and blood tests. Sometimes, doctors also recommend metformin, a medication that improves how your body uses insulin. Many women with PCOS have insulin resistance, which can interfere with ovulation. Metformin can help regulate your menstrual cycle and promote ovulation, especially if you have high insulin levels. While it may not be as effective alone as letrozole or clomiphene, it can be useful when combined with other medications. When preparing for pregnancy with PCOS, your doctor will likely start with letrozole or clomiphene and monitor your response carefully. If these don't work, gonadotropins might be the next step, but only with close supervision. Metformin could be added if insulin resistance is a concern. Tracking your cycle, understanding your medication schedule, and staying in touch with your healthcare provider are key steps to help you reach your goal of pregnancy.